Hello, I'm Kimberly Pierceberg, Executive Director of the AIAMC, and it's my honor to share with you information about our organization as well as the benefits of membership. The AIAMC is the only national organization supporting the needs of independent academic medical centers. There are certainly many organizations nationally supporting GME. However, they represent university teaching sites only, or perhaps sponsoring institutions from both independent centers as well as university and smaller community teaching hospitals. We believe that we're large enough to achieve meaningful work and outcomes, while small enough to allow exceptional collegiality and networking. We were founded in 1989 and are celebrating our 35th anniversary this year. Here are our mission, vision, and tagline statements, and keywords that I wish to point out to you are innovation, scholarship, exceptional patient care. AIAMC members follow the tricycle analogy in that the large tire up front that drives what we do, that is really all about why we are, is patient care, while the two smaller tires in the back, medical education and research or scholarship, are what drive and lead us to those exceptional patient outcomes. We believe our members are high performers, and we regularly track the awards and recognition that they receive, including some that you see here on your slide from Health Grades and U.S. News and World Report. This slide shows the AIAMC by the numbers, as well as highlights our partnerships with many national organizations, including the ACGME, AHA, AMA, and many others. These organizations send representatives to serve on the AIAMC National Advisory Council in support of our national initiatives, which I will now highlight. If you have been in medical education, or in healthcare for that matter, for more than 2 decades, you likely remember the Institute of Medicine's Quality Chasm Report, Crossing the Quality Chasm. For those of us in healthcare at that time, it shook us all to our core because it really very painfully shone a spotlight on the inefficiencies of healthcare, the lack of quality, and the concerning lack of patient outcomes, and how patient safety greatly needed to be improved. Many national organizations undertook quality improvement and patient safety initiatives at that time, and the AIAMC looked at all of those to find out where we could bring a unique contribution to that body of work. What we realized was that while there were many very important initiatives going on, none of them included residents. And we know, working in medical education, if you want to know what's going right or what's going wrong in your hospital, ask a member of your house staff. So that is when we decided to create our national initiatives, launching our first one in 2007. These initiatives are led by resident members. They lead a multidisciplinary team. Members on the team are determined by the project or the type of work that they're doing, and might include nursing, pharmacy, IT, DEI, and other departments. Since 2007, 70 hospitals and health systems and over 1,500 individuals have participated in 266 quality improvement projects. The structure of our national initiatives is that we choose a hot topic. The initiative is 18 months in length. Our members apply to be a part of the initiative. And there are 4 in-person meetings of all the teams, which are typically 25 to 30 teams, hospitals, across the United States. In addition to those 4 in-person contacts, we hold monthly Zoom meetings for our cohorts. The cohorts are smaller, with 5 to 6 teams in each of them, with projects that are similar to one another, thus maximizing the ability to network and learn from one another. In our first national initiative back in 2007, you'll see our theme was the IHI's 5 Million Lives campaign. And that brings a key point to that the projects our members do must align with their own hospital or health system's strategic goals. That is, must align to the C-suite. That's been key to our success through the years. That first initiative had 19 people involved back in 2007 and 8. Our current initiative on addressing the social and moral determinants of health has over 300 individuals involved. I would now like to share a couple of stories to bring these national initiatives to life, I hope. Both of these are going to be from National Initiative 5, which was held in 2015 to 2017, so going on nearly a decade ago. And they have sustained their results and spread their work. The first example is TriHealth, located in Cincinnati, Ohio. Their project was on food insecurity. The GME team learned from their VP of Mission that a relationship had already been established with the local food bank. They were not aware of this when they chose this project. They found out that mobile markets were going into areas in the greater Cincinnati region known as food deserts, but unfortunately, they were extremely underutilized, and the C-suite was really frustrated with the lack of utilization of these mobile markets. So the National Initiative team suggested bringing the mobile markets to the resident-run clinics on the hospital campus. Utilization increased significantly, as did patients' food preferences to include more healthy fruits and vegetables in their diets. In the center of this photo is the resident lead on this project. She was at that time a Patient Safety and Quality Improvement Fellow, Dr. Ginger Klarquist. She is now in practice as an OBGYN in Denver, Colorado. The second example from the same initiative on health equity comes from Orlando Health in Orlando, Florida. Their project aim was to increase the number of Vietnamese patients in their internal medicine residency continuity clinic by raising awareness of the hepatitis B virus, or HBV. Orlando, Florida, ranked as a city with one of the largest Vietnamese populations in the United States. However, they represented less than 5% of the patients in the internal medicine residency clinic, despite their close proximity to that patient population. Many had immigrated to the area without access to healthcare, so the team was puzzled as to why they didn't see more patients from this community in their clinic. Following a bit of research, they found out that their clinic was funded by the Orange County government, which set requirements for eligibility. And the most frequent barrier encountered was that those who applied had not lived in the country for longer than the 3 years required, or they made slightly above the minimum income requirement. So, not to be daunted, the team knew they couldn't get the patients in their clinic, so they went out into the community. The National Initiative team developed relationships with the Asian Area Chamber of Commerce, as well as the Vietnamese health professionals of Central Florida, to participate in community health events. They also connected with local temples and churches and held educational events about HBV after those services. In the TriHealth example, it was best to serve patients in the hospital clinics where they were already being treated. With Orlando Health and many others through the years, we have realized that when GME teams are able to go out into the community, that will optimize their results. Then resident Dr. Annie Chow, in the center of this picture here, led this quality improvement project. She now operates Chow Medical Group in Orlando, and every staff member on her staff are fluent in both English and Vietnamese. When I think of these two residents, when I think of Ginger and Annie, and the hundreds rather, of others who have developed leadership skills in our national initiatives, I am truly heartened to think about the most fortunate patients they now serve in Colorado and Florida, respectively. We'll now shift to member benefits. In addition to the ability to participate in our national initiatives, Some of the benefits are highlighted here, including networking and collaboration, which our members regularly tell us is their number one most valued benefit, publications and communications, references and resources. And it's important to note that membership in the AIAMC is institutional, meaning a hospital or health system is the member, and an unlimited number of individuals may participate and take advantage of member benefits. So everyone on your GME staff, your program directors, select faculty, your residents, of course, anyone that you wish to be involved in the AIAMC may be, and we welcome them. Some examples of networking and collaboration are in-person meetings, webinars that we hold around hot topics, which we always record so that you may watch them at your leisure. Facilitated networking, including our member listserv. We've recently added podcasts to our programming menu so that members, again, can access at their convenience while they're working out in the morning or commuting to and from work. Some of our publications include the bi-monthly Alliance Update newsletter, weekly email blasts from me called AIAMC This Week, and the Auctioneer Journal, which is the official journal of the AIAMC and our national initiatives. When you participate in the national initiative, your final project report is included in a special proceedings booklet from the Auctioneer Journal, and every project and every publication given its own PubMed number. References and resources include our job board, which is free to AIAMC members, a resource directory where you can search by subject matter, the great information shared on our member listserv, as well as direct URLs to our many national connections to the organizations I've already noted. New members who join the AIAMC by March 1st, 2025 will receive 2 free annual meeting registrations. That's a value of nearly $2,000. So we do hope you will join our membership and join us in person in New Orleans in late March of next year and take advantage of that exceptional networking our membership offers. Here is my contact information, including my email and my cell phone number. Thank you so much for the privilege of your time. I really do look forward to hearing from you, and I hope to welcome you soon to membership in the AIAMC. Thank you.